Welcome back, everyone. Our last lecture is on electrotherapy. But first, a polling question. Dr. Robert Becker, an orthopedic surgeon at the Veterans Administrative Hospital in Syracuse, New York, was working with veterans who had broken bones and missing limbs in the 1970s. As part of his research, Becker measured the direct current along the body of a salamander. He found that the head was positive and the tail was negatively charged, and he believed this related to the nervous system. When he did more careful readings, he found that the body was positively charged relative to the limbs that were negatively charged. When a chemical anesthetic was used, the charge disappeared. If you amputate the limb of a salamander, it is able to regrow that limb. If you amputate the foot of a frog, it will regrow a stump. Becker wanted to know why. He measured the electrical activity at the site of the amputation and found that with a salamander, the electrical activity became positive and then it became negative. With the frog, the electrical activity at the cut remained positive, and he believed this had something to do with regeneration. A careful study revealed that after amputation, the skin grows over the wound and the nerve grows into the cell. This is called the neuroepidermal junction. A negative electric current is formed at the site of healing. Normal cells become primitive stem cells that then redifferentiate to form the digits of the salamander. The negative electrical current is essential for this healing to take place. Initially, they replicated the negative charge by inserting an electrode at the break, and non-union bone fractures healed within 8 weeks. Today, pulsed electromagnetic therapy is used for the same thing, and this type of therapy is non-invasive. Becker wrote 2 very interesting books, The Body Electric and Cross Currents, that are both highly informative. In Cross Currents, he mentions the promise of electromedicine that I will be talking about later in this lecture. In 1979, the Food and Drug Administration approved PEMF therapy for bone healing. 3 years later, in 1982, Andrew Bassett, who was also very active in this field, published this paper in JAMA, the Journal of the American Medical Association. He reported that PEMF therapy was effective in 75% of the cases that were initially classified as non-union bone fractures. Today, pulsed electromagnetic field therapy is used for pain and inflammation, soft tissue healing, and even depression, and it is increasingly being used on animals, especially horses. Pulsed transcranial magnetic therapy is being used at the University of Toronto Centre for Addiction and Mental Health. Students and others are asked to volunteer to be tested. A strong magnetic field is placed next to the head and subjects are exposed for a few minutes. This treatment is approved by Health Canada as a Class 3 medical device. While there is considerable research testing this therapy, it is intended only for those who have drug-resistant depression. Treatments last several days for over a week, and more patients need to return after several months as the depressive symptoms return. I became interested in PEMF therapy and wanted to know if this therapy works and if people with electrohypersensitivity could use it. One of the ads stated that it enhances blood circulation, so I decided to test this myself. I took a drop of blood, placed it on a slide, and then examined it under the microscope. And this is what I found. Here is my blood before and after an 8-minute treatment on a PEMF mat. Blood cells are all individual and they are not sticking together. I was really amazed at the results. The benefits are obvious and include improved circulation, improved waste removal, and reduced risk of blood clots, stroke, and heart congestion. Since that first blood test, I have traveled to various places in North America and Europe to learn more about PEMF technology. Beamer comes from Liechtenstein, where I met the then CEO of the company. He introduced me to the work of Dr. Rainier Kropp, an expert in microcirculation in Berlin. These videos are of blood circulating through blood vessels before and after a Beamer treatment. It reminds me of a traffic jam during rush hour. Note that the blood is flowing more smoothly after the Beamer treatment. We can watch this again. The difference is quite remarkable. After Liechtenstein, we went to the Paracelsus Clinic in Switzerland and met with Dr. Thomas Rau. Dr. Rau uses pulsed electromagnetic therapy in his clinic for various conditions.
What we use is a magnetic field. We use it for increasing circulation. We use it for cancer patients. We use it in another frequency of 50. We use it as a tool against inflammation. Or we also use it for bone healing and osteoporosis. When a patient needs an extraction of a dead tooth, which is a focus and which can make such interference, then you have to pull the tooth. Afterwards, we treat the patient just after the action of extracting. We treat the patient with a frequency of 50 per second in an intensity of 10 millitesla and about 15 minutes. And this for several days. And they have not a second of pain. It's absolutely amazing.
Closer to home in Quebec, Dr. Roland Rollet designed Rheumart for rheumatism and arthritis. He is holding a pad that you can place on various parts of the body, or you can place your body inside these two hoops. He based his design on the action potential of a nerve cell and on the Tesla-Schumann frequencies, or the heartbeat of the earth. Dr. Marangel tested this technology in his clinic using electro-interstitial scan. We placed electrodes on the patient's forehead, and he placed both hands and feet on two metal plates. This patient was suffering from chronic pain that Dr. Marangel was unable to resolve. The electro-interstitial scan identified the vertebrae that were inflamed in red. After a 10-minute treatment, according to the patient, there was an 80% reduction in back pain. An immediate follow-up scan revealed that the inflammation had been resolved. So we have both subjective and objective evidence that PEMF therapy can reduce pain and inflammation. 2 weeks later, the pain had not returned. Centurion is PEMF technology also from Canada. Here we have one ring that fits around your body. It provides 4 frequencies at 2, 8, 15, and 30 hertz. We tested this therapy with patients who suffer from osteoarthritis. Here are the results for one of the test subjects. This is a woman in her 60s who was unable to make a fist and was unable to raise her left elbow above her shoulder. After a 20-minute treatment, she improved noticeably. After 9 treatments, she continued to improve. I want to draw your attention to her left hand. The deformity, or the space between her first and second finger, seems to be much less after these 9 treatments. OnDemand is technology from Germany that uses biofeedback during treatment. This technology can assess what is out of balance, and then can treat the underlying problem. Here we have a case involving pleural effusion after open heart surgery. Here we have a 60-year-old female who developed a pleural effusion, fluid around the lung, that made breathing difficult after open heart surgery. She had a chest x-ray on August 2nd and another August 9th with no change in her condition. On August 20th, she had another x-ray and the condition was getting worse. In September, she received 2 on-demand treatments on 2 consecutive days. After the first treatment, there was no difference in her breathing, but after the second treatment, she could take a deeper breath. Her next x-ray revealed a significant improvement. According to the radiologist, the pleural effusion shows a dramatic reduction in size. He thought that the patient had the effusion drained, but there was nothing invasive done to reduce the fluid around her lung, only 2 20-minute treatments on on-demand. Seqex comes from Italy and is a Class 2 medical device approved by Health Canada. This technology has individual preset programs based on brainwaves and special frequencies for regeneration, microcirculation, sports endurance, etc. It can also be used to assess the body, and then a personalized prescription card is produced for that patient to use at home with their home model. Lots of research has been published on Seqex: pain and bone disorders, protection against the side effects of chemotherapy, oxidative stress reduction, multiple sclerosis and heart disease, autistic syndrome, and spur mobility, just to show how diverse this technology is. And I'm going to share with you just one of these studies. MDA is a biomarker for oxidative stress. 32 healthy volunteers participated in the study. Peripheral blood samples were taken for MDA concentrations before and after exposure to Seqex. Here are the results before the PEMF treatment and after PEMF. While a few had higher levels of MDA, most had significantly lower levels, showing that Seqex can mitigate oxidative stress in the body. Foot injuries tend to heal very slowly. Here is a foot injury treated with Seqex that healed within 2 months. This type of treatment is particularly useful for diabetics who develop foot sores. According to PubMed, there are almost 400 publications for the search term PEMF therapy and over 600 for PEMF. It's clear that interest in this technology and research is increasing. In Google Scholar, using the search term PEMF in a health condition reveals thousands of documents. PEMF and bone healing, pain, inflammation, wound healing, nerves, cancer, and the list goes on. With so many publications, it is odd that PEMF has not been embraced by many doctors in North America. As of September of this year, pulsed electromagnetic field therapy in dentistry gave over 20,000 results. We have heard earlier that Dr. Thomas Rau uses PEMF in his clinic in Switzerland to eliminate dental pain. Here is an early study, 1971, showing the percentage of patients who experience no pain after dental surgery. Those exposed post-surgery to PEMFs in blue did better than controls in black, who did not receive a PEMF treatment. And those who received both a pre- and post-treatment experienced the least amount of pain and the least amount of inflammation. In dentistry, blue light is used as an antibacterial, and red light is used to stimulate circulation, to promote regeneration, and to reduce pain. Light therapy in dentistry is gaining in popularity. This takes us to the different types of light therapy. Heliotherapy refers to the sun, and this has been used for decades to treat patients with tuberculosis. Phototherapy, blue and ultraviolet light for the treatment of jaundice in newborns. Chronotherapy, or bright light in the morning for seasonal affective disorder. Color therapy that we just discussed in dentistry. Low-level light therapy, and information therapy that I find the most intriguing. According to PubMed, we now have over 1 million articles on frequency therapy and several thousand dealing with light therapy, photo, and chromotherapy, and several hundred publications on heliotherapy and low-level laser therapy. Depth of skin penetration is a function of wavelength. Red light penetrates the deepest and blue light penetrates the least. This shows us the effect of different colors of visible light. Blue light is antibacterial. Yellow light has an anti-inflammatory effect. Orange light is for local microcirculation and to stimulate growth factors and immunomodulation. This person has tennis elbow, and the inflamed area shown in red and orange based on infrared photography. After a 4-minute treatment of using low-level laser therapy, there was much less inflammation. And after 8 minutes, there was no inflammation and no pain. Here we have a woman recovering from surgery. Her right eye was treated with light therapy. Her left eye remained untreated. The difference in healing is considerable. Surgeons should be using PEMF or light therapy to help their patients heal more quickly following surgery. Do plants need light to survive? Any light? Chlorophyll A and chlorophyll B are 2 common photosynthetic pigments in plants. These pigments absorb preferentially in the blue and red part of the visible spectrum. A leaf appears green because it is reflecting green light and absorbing all other colors of the spectrum. Do animals need light to survive? Any light? We know that different colors have different effects. Near-infrared light stimulates ATP production in mitochondria and provides energy to the cell. Near-infrared light promotes gene transcription and enables the cell to perform its various functions. It also produces nitric oxide. And nitric oxide is important for vasodilation of blood vessels. Let's go to a polling question. Light can carry information, and that is how fiber optics works. With Wi-Fi, microwave is the carrier frequency. With Li-Fi, light is the carrier frequency. In the future, we could have light from special overhead bulbs transmitting information to our computers, cell phones, and tablets. Dr. Dieter Josner demonstrates how light can carry information using a light noise detector.
This instrument looks like white light, but it's a very special light. We can modulate the light with information, whatever it is, sound of music, sound of hypnotism texts, or sound of rhythms of the nature. I will show you how it works. I take here MP3 player. There's just a sound source, nothing else. Switch it on. Then I connect it to this light here, very easy. And now I take a detector to detect the sound of light. I switch it on. And there it is. We have the modulation from the sound recorder modulated to this light. And this light is not flickering. We don't see too much, but the subconscious is receiving it. From the subconscious is moving into the conscious, and after a while it's there. We don't know why, but still there, and we reacting on it. So with this we can learn languages, we can teach something. That is a very useful light for anything to learn or to treat people.
Light has energy and can carry information. These are some of the conditions that have benefited with PEMF and light therapy. However, it's important to remember that PEMF devices do not treat a specific condition. Instead, they optimize the body's natural self-healing and self-regulating functions. Now for 2 polling questions. Dr. Thomas Kuhn wrote a book called The Structure of Scientific Revolutions. He was interested in how advances are made in science and medicine. He noted 2 patterns. One is the slow and steady progress with few surprises. The other is destabilizing and unexpected, and it is these discoveries that make the greatest contribution to our understanding of the natural world. A prime example is the geocentric versus the heliocentric view of our solar system. He called this a paradigm shift, a fundamental change in an individual's or a society's view of how things work in the world. We are going through a paradigm shift in medicine, and with any paradigm shift, there is opposition. The germ theory of disease was a previous paradigm shift that met with a lot of opposition. Dr. Schimmelweiss recommended that doctors wash their hands after performing an autopsy and before delivering babies, as this was leading to a very high death rate among mothers and infants alike. The doctors didn't agree, and it took years before regular hand washing and disinfection became common practice. Here we have a visual paradigm shift. Can you see the 2 animals? In each of these images, there are 2 different perspectives. Neither is right or wrong. They are just different. Here we have a young woman and an old woman. And here we have 2 animals that are easier to see if you change the orientation. Our current medical paradigm is based on chemistry. We assess health by measuring chemicals in urine and blood, for example, and we treat conditions using nutraceuticals and pharmaceuticals. The medical paradigm shift is from chemicals to electromagnetic energy. I was at a medical meeting with some amazing doctors a few years ago. An elderly doctor said that he looked for 3 things when he was assessing his patients. Do they have all their essential nutrients? Do they have toxic substances in their body? And are their cells communicating with each other? This is the chemical model of disease. However, we have trillions of cells in our body that need to communicate instantaneously, and this can't be done by chemical messengers alone. Dr. Ross 80 said that cells are whispering to each other electromagnetically. And Dr. Fritz Popp contributed to this concept with his biophoton research. We can superimpose the frequency model on the chemical model and ask the same types of questions. Does a patient have all the essential frequencies? Is a patient exposed to toxic frequencies? And finally, are the cells communicating effectively with each other? This is the energy model for medicine. Here's another example of the changing medical paradigm. When we think of hormones or neurotransmitters, we are given this chemical model that is based on a lock and key. The key has to fit the lock perfectly, so size and shape are important for the hormone and the receptor. Can you unlock a car door at a distance? This question would have been ludicrous 50 years ago. Today, we do it all the time. What we are using is electromagnetic information. This concept comes from James Osman's book, Energy Medicine, The Scientific Basis. According to the authors of this paper, non-chemical and non-contact cell-to-cell communication. In our opinion, the research on principles of non-chemical and non-contact cell-to-cell communication has the potential to offer new fundamental insights into biological processes. And here we are not talking about energy, but information. What constitutes death of a person? No heartbeat. What constitutes brain death? No brainwave activity. What constitutes death of a cell? No electrical potential across the cell membrane. Death is the absence of electromagnetic frequencies. What does the future hold? Electrosmog is going to get worse, and electrotherapy is going to play a greater role in healthcare. May this information enrich your practice and help your patients achieve optimal wellness. And here are the final 2 polling questions for this lecture.